So whenever you find this kind of an abstraction, you will definitely have cracks in your teeth. You can make out these cracks here. Yes, these cracks are normally because of an abnormal masticatory forces coming on the tooth. So whenever there is abnormal forces on one side, so definitely other part of an enamel is going to affect it. That is why the cracks are here. So this is one of the feature of an abstraction. Sorry. Yes, you can make out this kind of an cavity I'll call as an abstraction. Now you may get confused with the abstraction as well as the abrasion cavity, right? It's a mechanical or whether this is an abstraction. So if you want to consider whether this is abrasion cavity, but it is not V-shaped notch, right? It is definitely at the cervical point, but is it a V-shaped notch? No, it is not a V-shaped notch. Second criteria, look for the teeth or look for the occlusion, whether they are traumatic occlusion. You can make out facet here. I'm sorry for this photo, but you can make out some wearing off in here. So that means this tooth is giving some abnormal forces on the buccal side of the tooth. See the flattening of the canine. This is canine, this is first premolar, second premolar. See the flattening. And here, see the cuspal tip. See here. Okay, so what it suggests? The occlusion is irregular, the tip is irregular, it's flattened here. Okay, so what they are suggesting, that is there is a presence of a traumatic occlusion. So whenever there is a presence of a traumatic occlusion, definitely there will be chip off of enamel. The enamel at C junction is very thin, so they get chip off from the cemento-enamel junction and you will have this kind of a cavity. So the initial phase will be like this. So these cavities are nothing but an abstraction cavity, and yes, this cavity are transformed into abrasion cavity later on. So why it will be converted into abrasion cavity? Now enamel is not there. So dentin is exposed to the brush mechanical, they can expose to the mechanical wearing, friction. So that is why this kind of a cavity are getting converted into abrasion cavity. So maybe you will not able to make out, but you definitely have to look for this kind of changes in the tooth. See, what treatment you will suggest in these cases? Yes, filling, definitely. You will go for the filling what is there in, what filling, the same filling you are going to do in the abrasion cavity, right? Yes, abrasion cavity. But will the filling will remain here for a longer period? No. If enamel is getting chip off from here, so why not filling will get chip off? Filling will also come out. That means because it is traumatic occlusion. Because of traumatic occlusion, if enamel is coming out, so any filling you do it in this area, they will also come out. Okay, so for that, first you have to correct the traumatic occlusion. Traumatic occlusion is what? How will you correct that? Selective grinding. So the plunger cusp means the cusp which is giving more or extra forces on the opposite tooth. So the plunger cusp, all occlusion has to be corrected. Plunger cusp has to be reduced. So if you remove the traumatic occlusion or traumatogenic occlusion into the normal occlusion, so definitely if you do the filling also after that, it will stay for the longer time. So that is why first thing you have to correct the traumatogenic or a traumatic occlusion in relation with the abstraction cavity. Okay, so this is the difference between abrasion and the abstraction cavity. Then the next one is a dentin sclerosis. It's also called as a transparent dentin. Why there is a dentin sclerosis or a transparent dentin? It's a reflective phenomenon. That is why it's appeared to be transparent. That is why it's called as a transparent dentin. You can make out here. It's totally transparent here. This is what is a transparent here. Okay. So it's because of the calcification of the dentin tubule, because secondary dentin or maybe a dental caries has been formed. So because of dental caries has been formed, underlying there will be a new dentin formation, tertiary dentin formation, and this get calcified. This surrounding dentin get calcified. This area get calcified. So that is why there is a deformation of a dental sclerosis. So it's a change in the reflective index. That is why this appears as a transparent in color. And sources of calcium is considered to be from the dental leaf. Okay, so that is why the calcification occurs. So from where, suddenly from where it will come? It will come from the dentinal nymph. The next is a dead tract. It's an optical phenomena. As you have learned in the first year also. Dead tract, it appears black in color, but that is also it's a change in the refractive index. It appears black in the transmitted light and white in the reflected light. So why this dead tract is occurring here? Because there is a wearing of an enamel on the edges. Sorry. So wherever there is a wherever there is a opening of the dentinal tubule to the surrounding environment, so that time air will get entrapped into the dentinal tubule, and this gives a refractive phenomena here. So that is why this tubule totally appears as a black in color. Okay, and below this dead tract there is a reparative dentin formation. This C part is a reparative dentin formation. So any treatment suggested? No treatment is required as far as there is a secondary reparative dentins are there. That is why the chances of infection is also less over here. Okay. Yes, this filling supposed to be done, but will it remain on the tooth surface? No, the filling will not remain on this surface. Only thing is correction of the attrition, abrasion, whatever the things are. Which are the factors responsible for this attrition, abrasion? How to correct that? Secondary dentin formation. Yes, you know this phenomena, secondary dentin, when there is irritation on the top surface. So, if even the height is also getting reduced, so that time you will have a secondary dentin formation below the normal dentin. Then another one is the reticular atrophy of the pulp. Yes, as age grown up, the pulp chamber size reduces. Okay, so whatever there is in young person or a young tooth, it will not be the same as in the young one in the older age. Okay, because continuously the formation of a tertiary dentin, secondary dentin formation is there. Even pulp fibrosis is another thing. So where the chamber size or a pulp canal size is getting reduced in the size. So that is why the old age persons, even after having a deep attritions, the patient will not complain of any sensitivity, he will not complain of any pain, just because of either because of fibrosis, the pulp content is less. So that is why there is no pain, no sensitivity, and even after exposure of the pulp also there will not be pain, or maybe it get calcified. So calcification, pulp calcification, again different kind of calcification. This is what the linear pulp calcification. It's normally along with the blood vessels, and it goes in vertically. The calcification goes vertically and it's diffuse. So everywhere it is spread along with the pulp chamber. Then this is another type of calcification. This is also called as a pulp stone or a denticles. The stone which are present, again the three types of pulp stone: free, attached, and the embedded. True and false pulp stone. What is true pulp stone? Which is from the odontoblastic process. That means the odontoblastic process get entrapped or get detached from the surface and enter into the pulp chamber, and from where they are started calcifying start forming the dentinal tubule. So the area is not in favorable of the formation of a tubule. So they form a round circle in surrounding it. So that is why they get calcified also, and that forms a true pulp stone. False pulp stone is just in calcification into the pulp chamber. Then the resorption of the tooth. Resorption of the tooth. There may be external resorption or internal resorption. Yes, sometimes the pathology is associated with the resorption of the tooth. So external resorption is because of periapical inflammation. If you see the lesion below the apical area, that time you will have an external resorption. Reimplantation of the teeth. What is reimplantation of the teeth? Implantation means putting back, putting in the implant. You have to put in the area of the tooth. Reimplant means if the tooth is avulsed or come out from by accident, and you are putting that tooth back into the oral cavity or in the socket of the tooth, previous socket of the tooth, that is called as reimplantation of the tooth. So sometimes the implantation successful will be depending upon the time duration from the avulsion to placement. So if more time has been passed away, so the implantation will cause a resorption of the tooth. any tumor and cyst associated with it, impaction of the teeth, that also causes resorption of the tooth, excessive mechanical or occlusal forces, and sometimes idiopathy. Internal resorption is totally idiopathic in no region. So here you can make out periapical infection or inflammation surrounding the tooth causes the resorption of the apical area of the root. Here see the root portion totally gone. What is it? It's either cyst or a tumor below the tooth. So that is causing total, see the one root has totally, mesial root has totally resorbed because of cyst or tumor. You can make out here the periapical infection is also there, as well as the internal resorption is there. Internal resorption means inside the pulp chamber. Here see the amount of resorption. The maximum resorption occurs because of the severity of the lesion, okay, and continuous pressure on the tooth, so that causes resorption of the root area of the tooth. Here, what is this? Internal resorption. Resorption occurs inside the pulp chamber. Maybe, see, there is no periapical infection, still the internal resorption is there. It is considered to be, sometimes it is considered to be an anacoratic infection. That means infection is coming from the blood and started lesion inside the tooth cavity, inside the pulp chamber, and causes the resorption of the internal resorption of the tooth. Sometimes it's also called a pink tooth. Normally deciduous tooth appears to be a pink or maybe central incisor normally. Because of resorption, the root has been resorbed and increased amount of blood circulation in that area. So that is why they appear to be pink in color. So it's called as a pink tooth. Then hypocementosis, excessive amount of cementum on the root area. So this excessive amount of cement formation here, see here, PDL is not there, you cannot make out the periodontal ligament outline, but the periodontal ligament continuation is along with the cementum, that cementoma. Okay, so that is the differential diagnosis, or that is the identifying criteria, that is, this is the hypercementosis, because this pedial ligament enlarges or goes surrounding to the enlarged mass of the cementum. Sorry. Then semanticals, the calcified mass adherent or detached from the root surface, so that is called as semanticals, represent a dystrophic calcification far away from the area. Then develop, either it is developed from the calcified epithelial cell rest, calcified Sharpie's fibers, or calcified thrombosed vessels, or maybe spicules of the cementum, or a bone displaced in the periodontal ligament. So, but the most common theory considered to be the epithelial cell rest of Manasseh, which gets calcified in it because they are active cells. They get calcified. Sometimes they get calcified and forms in concentric ring. So again, they are often 2-3 types: free, attached, and embedded. Embedded is this kind of an embeddation into the cementum. Sometimes they may be embedded into the bone also. So this is what is the periodontal ligament space. See the blood vessel, near the blood vessel. If you see the lines also here, concentric lines are along with the semanticals incorporated in. So this, it is not associated with the pathology, but they are definitely in the periodontal ligament. So it of no significance, clinical significance normally is not there. So even the treatment and anything is not required for the semantical. So this is all about the regressive alteration of the tooth. Thank you very much.